Scott, we've spent a lot of time this morning talking about what a mess it is in terms of distribution and actually getting the shots in people's arms. I think I heard earlier this morning that something like 22 million doses have been distributed, and maybe more should have and could have been distributed if we'd been keeping up and doing what you just suggested. But even beyond that, even with the stuff that's been distributed, we can't get it properly into patients' arms. We've got something like 6.5 million doses of that 22 million that have actually made their way into a person's arm. What is going on? When do we get to the point where we streamline this a little better? And when can we get past this idea of everybody fighting about who's jumping the line and who's not? How long are we going to be stuck in this limbo?
Well, I think that's one of the keys. I mean, we are very focused on creating a system to make sure no one that we don't deem eligible to receive a vaccine gets a vaccine. And the more rules we create, the more penalties we put in place, the fewer vaccines are going to be delivered. I think that's just the bottom line. And if we want to make sure that there's absolutely no one who purportedly jumps the line, we're going to have a system that really crawls. And so I think we need to get over that and recognize that every vaccine that we can get into someone right now, given the urgency, and this new variant is a public health win in some regards. There's 47 million vaccines that have been allocated, and about 7 million have been injected. So there's about 40 million vaccines that are sitting on a shelf somewhere. They're either with the states, with the federal government. Doesn't really matter. They're not in a patient's arm. There's 50 million senior citizens in this country over the age of 65. And so those 40 million vaccines look very attractive if your goal is to try to vaccinate the entire population of senior citizens in this country. You have more supply than you think you do. I think in terms of the Biden administration, it's going to be very hard to fix this system now that's been created. I think that what they can do right away, and they'll try to fix it over time, but I think what they can do right away is wrap around it. Create new distribution points. They're talking about creating these federal distribution points in stadiums. That's a good idea. You can drive a lot of volume through that. But a lot of people don't want to go to a stadium to get a vaccine, especially a senior citizen. So, again, I come back to trying to push it through channels where people currently get vaccines, like the big box stores. The federal government can turn on right now a system that they've engineered to push vaccine directly from the federal government through big box stores. And you can allow people to go online and schedule appointments 2 months out. So at least people have some certainty about when they're going to get vaccinated, and some of this uncertainty is taken away.
I hope people are listening. I think that's an important step.
Shepard Smith here. Thanks for watching CNBC on YouTube.